Okay, good morning, everyone. We hope that you are all safe and sound on this very, very snowy morning and have your coffee ready for our webinar today, which is Coffee with Your Pharmacist. And we have Miss Jerry Lynn Millwheat here with us today, and she's going to talk about tips on cardiac medications. And so just a few housekeeping items before we get started. Jerry, and like all of our other experts, cannot talk to you about very specific health-related questions. So if you have a health-related question about your own health, please talk to your own provider about it. And then if you don't have a provider, we have plenty on arh.org that should be able to help you. Secondly, the Q&A session will be open throughout this webinar. So please feel comfortable in asking questions on Q&A, and we'll talk about those questions at the very end. And if you have sent in questions via email, those have been provided to Jerry. And so she's going to answer a few during her presentation, and then I have a few in front of me as well, and I will ask those at the end. So we're going to jump right in very quickly this morning. So Jerry, I'm going to hand the reins over to you. And again, Jerry is our community pharmacy clinical services coordinator out of Hazard ARH and does a lot of stuff for our system as a whole at ARH. So welcome, Jerry. We're very, very happy to have you. I'm going to hand the reins over. You won't see me again till the end, so please take it away.
All right, thank you, Danielle. Good morning, everyone. Thank you for joining me for coffee this morning. As Danielle mentioned, we are going to be discussing cardiac medications this morning. I work with our retail pharmacies throughout our system. I'm based here in Hazard, and we're going to just jump right on into tips on cardiac medications. So let's start with cardiovascular disease this morning. One person dies every 36 seconds in the United States from cardiovascular disease. 1 in every 4 deaths is from heart disease. According to information from the CDC, someone has a heart attack every 40 seconds. About 1 in 5 heart attacks are silent. That means the damage is done, but the person is not even aware of it. In our region, the Appalachian region, we have higher incidence of heart disease. According to Health in Appalachia, over a 6-year period, heart disease mortality rates in our communities in Appalachia was 17% higher than the national rate. So what is heart disease? Well, heart disease or cardiovascular disease can be used interchangeably. They describe a range of heart conditions. This can include high blood pressure that leads to heart disease. It can include arrhythmias, congenital heart defects, coronary artery disease, heart attack, stroke, and heart valve problems. So now that we've talked about all of these scary stats from the CDC and defined heart disease, let's move on to cardiovascular disease treatment. So how can we treat and slow the progression of heart disease? The first thing that we can do is make healthy choices. This means develop healthy habits, choose healthy food options, choose healthy drink options. It's a great idea to maintain a healthy weight and to get regular exercise. Next is to stop smoking. There are many resources available to assist you in stopping smoking. Many are covered by your insurance with little or no copay. That means they may even be free. So that's a win-win to help you stop smoking at no cost to you. You can talk to your doctor, pharmacist, or your provider about the best option to help you stop smoking. Next up, we have controlling your cholesterol. Controlling your cholesterol with diet and exercise can help lower your heart disease risk. Next, we move on to taking your medications as directed. Taking your medications can help treat cardiovascular disease and slow the progression. It is extremely important to take your medications as directed each and every day for each and every dose. There are many medications to treat heart disease. We're going to look today during our presentation at more common classes of medications. We're going to cover anticoagulants, blood pressure medications, cholesterol medications, and heart failure medications. It is important to remember that heart medications can work in different ways and on different pathways in the body. For example, blood pressure medications can work several different ways. They can help keep your blood pressure at a healthy level by helping your body to get rid of excess water. They can help to relax your blood vessels. They may help your heart beat with less force and not have to work as hard. They also may help to block nerve activity that can restrict your blood vessels. We're going to take a look at several classes of commonly taken heart medications that treat heart disease. If you do not hear me mention your specific medication, don't be alarmed. We're just going to talk about the most frequently prescribed medications and review them as a class. So first off, we have anticoagulants and antiplatelets, also known as blood thinners. So these medications do not actually thin the blood, but they help to decrease the clotting ability of the blood. They help prevent blood clots from forming within the body that can then travel and cause more serious problems such as heart attack or stroke. Anticoagulants help prevent dangerous blood clots from forming. Examples of these include Coumadin, Eliquis, Pradaxa, and Xarelto. Antiplatelets keep blood platelets from sticking together, causing blood clots. Examples of antiplatelets include aspirin, Plavix, Effient, and Brilinta. Sometimes you may even be on aspirin plus one of these other medications on your screen. Your treatment with these agents will depend on your specific heart condition and other risk factors. It is important to take these medications exactly as prescribed and not stop until your doctor tells you to do so. The most common side effects of these medications is bleeding. You may bruise easier and bleed longer from small cuts. If you were to experience any increased extreme bruising, bleeding, or blood in your stool, or when you brush your teeth, notify your doctor immediately. It is also extremely important to make sure all of your healthcare providers know that you take these medications. This includes your dentist, any providers that you may be seeing before surgical procedures, including colonoscopies. Our next class of medications is ACE inhibitors and angiotensin II receptor blockers. These are very common medications and first-line heart medications. They are also available in combination products with other heart medications, including water pills. I've listed some of the more commonly prescribed angiotensin converting enzyme or ACE inhibitors on the left side of our screen. These medications typically end in pril. For example, lisinopril is a common heart medication. Ramipril, generic for Altace, is another common heart medication used to treat many heart conditions. Angiotensin II receptor blockers typically end in sartan. Losartan, generic for Cozar, and valsartan, generic for Diovan, are common examples of these medications. So these medications work on the same pathway in the body to either lower levels of angiotensin II or prevent it from working. So you're probably thinking, well, what's so bad about angiotensin II? Well, it can increase your blood pressure and cause constriction of your blood vessels, which means your blood's not going to flow as easy. These medications work to help lower your blood pressure and help your blood flow easier. Common side effect of ACE inhibitors is a dry cough. If you experience a dry cough, then an agent on the right side of the screen may be a better option for you. These medications can also increase potassium levels. Potassium is an electrolyte that can be monitored with routine lab work. In addition to your potassium, your doctor will likely monitor your kidney function if you take one of these medications. It's a good idea to have lab work every 3 to 6 months to monitor your electrolyte levels and kidney function while taking these medications. If you have ever had an allergy to any of these medications, it is important to make sure all of your doctors and pharmacies know and have it recorded in your medical record. Additionally, if you are pregnant, you should not take any ACE inhibitors or angiotensin II receptor blockers. So moving on to our next class of medications, we're going to look at beta blockers. So your heart is a muscle. Beta blockers help your heart to not work as hard. This helps lower blood pressure and the heart not have to beat as fast. Beta blockers work to decrease your heart rate, and they typically end in OLOL. Metoprolol is generic for low pressure, or Toprol XL. Atenolol is generic for Tenormin. These are common beta blockers. We also have combination alpha and beta blockers. These also treat high blood pressure, help decrease heart rate and how hard the heart has to work, and are used for heart failure. Carvedilol is a commonly prescribed combination alpha and beta blocker. That's generic for Coreg. So many of these products on the screen come in combination products and extended release products. The great thing about extended release products is you typically only have to take those once a day, making it more convenient for you. The most common side effects are decreased heart rate and decreased blood pressure. While decreases are not always a bad thing, in fact, that might be what we're trying to achieve here. If your heart rate or blood pressure falls too low, you may experience side effects that can include fatigue, tiredness, or dizziness. It is important to work with your doctor to find the right medicine and the right dose for you. If you take beta blockers and are diabetic, it may make it hard for you to notice low blood sugar. Therefore, it is important to closely monitor your sugar if you are diabetic and on one of these medications. Some beta blockers can block receptors that can cause breathing side effects. If you have any breathing conditions such as COPD, emphysema, or asthma, make sure your heart doctor is aware of those conditions. If you still need beta blocker treatment, a cardioselective beta blocker would be the best fit for you. Cardioselective means it works specifically on your heart, limiting any breathing side effects. Metoprolol, atenolol, and bisoprolol are beta blockers that work specifically on the heart. Any medication can have side effects. We've discussed lots of those for beta blockers, but it's important to remember the benefit of taking your medication like it is prescribed. If you have any concerns or issues, it's always the best idea to talk to your doctor or pharmacist. So we're going to be moving to our next class of heart medications, and those are calcium channel blockers. These can be used to treat high blood pressure, chest pain, and some heart arrhythmias. These medications block calcium from entering the cells of the heart and blood vessels. This helps your blood vessels relax in the heart and heart muscles. Commonly prescribed calcium channel blockers are amlodipine, that's generic for Norvasc, diltiazem, and verapamil. Side effects of these medications can include edema, which is just a fancy word for swelling, especially in your lower extremities, which is your legs. Other potential side effects include headache, flushing, and dizziness. Some of these medications may interact with other medications and over-the-counter products. It is important to make sure all of your doctors know what medications you take. Next is diuretics, also known as water pills. These help the body get rid of excess fluid and sodium. It helps reduce the buildup of fluid in your lungs and other parts of your body. This in turn helps lower your blood pressure and reduce how hard your heart has to work. The most common diuretics or water pills are furosemide or Lasix and HCTZ or hydrochlorothiazide. So these medications are best to take in the morning since they increase urination and cause you to go to the bathroom more often. Taking these at bedtime will cause you to be up more frequently during the night, which is bothersome and can lead to falls. These medications are often taken in combination with other blood pressure and heart medications. Some even come in combination products. For example, we already discussed lisinopril. That comes in a combination product with HCTZ. That means you can take one tablet and have the benefit of two medications, making it much easier for you. Side effects of diuretics can be fluctuations in your electrolyte levels, such as your sodium and potassium. It is important for your provider to keep a close eye on lab work that monitors for these. Routine lab work will also help to monitor your kidney function while taking these medications. Any side effects such as dizziness or lightheadedness should be reported. These medications may also make you sensitive to the sun, which can cause you to burn easier. Next, we are going to discuss vasodilators, digoxin, and Entresto. Vasodilators help relax your blood vessels and decrease blood pressure. These include hydralazine and your nitrates. Nitrates increase the blood and oxygen supply to the heart while reducing workload. This helps to ease chest pain. Nitrates can have side effects that cause headache and dizziness. Tolerance to nitrates may also develop. It is important to take your medication exactly as prescribed by your doctor and on your prescription bottle to help minimize tolerance and to maintain a proper dosing schedule. The appropriate time to take depends on your medication, your dose, and your frequency. Discussing that with your doctor or pharmacist is ideal to help prevent nitrate tolerance. Nitroglycerin also comes in many different forms, including sublingual tablets and sprays. It's important to make sure you are familiar with how and the best way to use your medication and to discuss that with your pharmacist. Digoxin is a medication that increases the force of your heartbeat. It helps to treat heart failure and irregular heartbeats. It's often used after other treatments are tried. It can be added to other heart medications and standard medication treatments to help treat heart failure symptoms. Digoxin has many side effects, drug interactions, and a narrow therapeutic window. So it's really important to make sure all members of your healthcare team know that you take digoxin. If you take this medicine, your digoxin levels, heart rate and rhythms, and electrolyte levels will be monitored and should be done so on a routine basis. Next up, we have Entresto. This is a newer heart failure treatment option that contains two medications. Entresto works to increase vasodilation, sodium excretion from the body, and contains an angiotensin II receptor blocker like we discussed earlier. Like many other medications we have discussed, kidney function, potassium, and blood pressure needs to be monitored while taking this medication. Entresto is taken twice a day. So next up, we're going to slide into our cholesterol medications, or statins, you may hear them referred to as. Atorvastatin and rosuvastatin, or Lipitor and Crestor, are commonly prescribed statin medications used to treat cholesterol. So cholesterol in itself is not bad. Your body needs it to build cells and make hormones, but too much can lead to problems. High cholesterol leads to increased risk for heart disease and stroke. You've probably heard of LDL cholesterol or your bad cholesterol. This cholesterol type can build up in your arteries and form fatty, waxy deposits called plaque. This can narrow the arteries. If your arteries become too narrow or the plaque forms a clot, it may lead to a heart attack or stroke. When you are unable to lower your cholesterol with diet and exercise alone, you may be given one of these medications to help lower cholesterol. Some cholesterol medicines may interact with other medications in food. These can be other heart medications or even grapefruit juice. Interactions can lead to increased chances of side effects or some medications not working as effectively as intended. It is important to tell all of your doctor and pharmacist what medications you take, including prescription, over-the-counter, and herbal supplements. When you take one of these medications, you will have lab work called a lipid panel. This checks your cholesterol and triglyceride levels. Liver function will also be monitored. If you were to experience any unexplained muscle weakness or fatigue, muscle cramps, and or dark colored urine while taking these medications, it is important to talk to your provider immediately. Zetia is also listed on the screen. It can be used for those who do not meet your cholesterol goals or cannot tolerate a statin after having a max dose statin or stopping. You may take it in combination sometimes. So next, we're going to discuss our heart health and over-the-counter medications. So the big thing that I recommend with over-the-counter medications is to carefully read the labels. Some over-the-counter medications can have a high sodium content. Some over-the-counter medications, such as NSAIDs, may cause the body to retain fluid. Common NSAIDs are ibuprofen and naproxen. Decongestants can cause a narrowing of blood vessels, which can increase your blood pressure. Examples of these are Sudafed or products that contain phenylephrine. You'll also often see combination products with PE at the end of the name. That means it has the decongestant phenylephrine as an active ingredient. It doesn't necessarily mean you can't take these medications for a short amount of time to treat whatever issue you are seeking. But it does mean that it's a great idea to talk to your doctor or pharmacist before you take any over-the-counter products. Aspirin is an over-the-counter product that I'm sure many of you take every day. It can help prevent heart attack and stroke. Talk to your doctor before beginning aspirin daily. Make sure it's the best fit for your cardiovascular treatment plan. Again, when in doubt, talk to your doctor or pharmacist. Additionally, you may find blood pressure monitors for home use at reasonable over-the-counter prices. These can be found at many home care stores and pharmacies. This will help you know if you are reaching your blood pressure goals and to check your blood pressure if you're experiencing any side effects. Blood pressure goals can vary based on the individual, age, and diagnosis, but typical goals are less than 140/90 or 130/80. Your doctor can help you set your individual blood pressure goals, and your pharmacist can work with you to help make sure you are taking your medications appropriately to achieve these goals. So some important reminders for our heart medications include take your medicine every day, every dose, each and every time, like the doctor prescribed. Follow the directions on your prescription bottle. Tell all of your doctors and pharmacies about any of your medications that you take. These include prescription medications, over-the-counter products, and any herbal supplements. And last but not least is don't be afraid to ask questions. When in doubt, talk to your doctor or pharmacist to make sure this medication is right for you, that you're not experiencing any side effects, and that you understand why you are taking it and how important it is to your heart health. So with the last bullet point, we'll wrap up our presentation and move on to our Q&A portion. So again, don't be afraid to ask questions.
Thank you, Jerry. We have a bunch of people that were not afraid to ask questions because we got a ton of questions on our email. I don't think we have any right now in our chat box, but we do have a ton that came through via email, so I hope you don't mind me asking you quite a few. So thank you. The very first one is, should thyroid and cardiac medicines be taken at different times?
Yes, so it is ideal to take your thyroid medication by itself consistently in the morning on an empty stomach, 30 to 60 minutes before food. That allows your thyroid medication to work the best.
Okay, so next question is kind of the same. So it says, is there a best time of day to take cardiac medicine? So we know when to take a thyroid. When should we take our cardiac?
Yeah, that's a great question. So it honestly depends on each individual and what heart medications you take. For example, we discussed how it's best to take water pills in the morning. Medications you take twice a day are best to take in the morning and in the evening, 12 hours apart. The most important thing is to be consistent in how you take your medication. Take it exactly like your prescription bottle tells you to each and every day. If you're on multiple medications, talk to your pharmacist and you can do a medication review to find what fits best for your medication and your lifestyle.
Thank you. So next, and I'm sure I'm gonna butcher this. It's how long should a person take amiodarone? Does that sound?
Yes, yeah, you did good, Danielle.
Oh, did I? Okay.
So amiodarone, yes. It depends on why you are taking amiodarone. Amiodarone is a medication that we did not get to discuss in our presentation in consideration of time. So just a little education on amiodarone. It's an antiarrhythmic, which means it is used to treat abnormal heart rhythms. So it depends on your diagnosis, your dose of amiodarone to help determine your duration of treatment. Amiodarone can also have some side effects that may affect how long you take this medication. It's important if you do take amiodarone to not stop or adjust it without talking to your doctor. But discussing with your doctor your reason for taking amiodarone and your dose will help determine how long you take it.
Okay, the next question is a great question, I think. And that's, can I call my pharmacist and ask questions?
Absolutely, absolutely, absolutely. Please call us. Call your pharmacy, ask questions anytime. You can contact your local pharmacy. If they're not available, we have 14 ARH pharmacies throughout our service area. We're always happy to talk to you and answer any questions. It's typically the highlight of our days. So please call, ask questions.
Thank you. Next is, does it matter what time of day you take your cholesterol and blood pressure medicines? And can they be taken together?
So it depends on your specific individual medications. The best thing to do is to take your medication like it indicates on your bottle. Depending on those medicines, a certain schedule may be best. Like we talked about earlier, I recommend talking to your pharmacist and doing a medication review to find the schedule that works best for your life and let your medicine work best at the same time.
Okay. So once you start blood thinners, do you have to stay on those for life, is another question.
Yes, another good question. And that honestly varies as well. It depends on why you started the medication and if you were taking it to prevent a blood clot, have had a blood clot before, have had a heart attack or a stroke. Each patient, each diagnosis, each treatment plan, those can all be different. So talk to your doctor or pharmacist to determine your ideal length of treatment and set your specific goals so you will have an endpoint in mind.
Thank you. And the last question, and you may have to kind of explain what this is there a medication that will help boost my ejection fraction? So you may have to talk about what ejection fraction even is.
Absolutely can do. So ejection fraction, that is the amount of blood that the heart pumps out with each heartbeat. People with heart failure may have a reduced ejection fraction. That is a type of heart failure. That means it's lower than normal. That can mean that the heart may be too weak to squeeze and pump normally. If you have heart failure with reduced ejection fraction, there are some options. We've talked about several of these classes of medications throughout our presentation today that help your heart not to have to work as hard. You may be on one or multiple medications for this. Your heart failure treatment plan should be designed specifically for you and set between you and your doctor. Often patients are on at least one of the medications that we talked about. Those include diuretics or water pills, ACE inhibitors or angiotensin II receptor blockers, and or a beta blocker. Again, you may be on multiple of these medications to help treat heart failure with reduced ejection fraction. The big thing to watch for if you're on any of these or have that diagnosis is any changes in breathing, weight gain, and increased swelling. This could indicate a worsening of your heart failure and will be time to talk to your doctor immediately.
Thank you so much, Jerry Lynn. So we are at the end of our questions, and we haven't received any, I believe, in our chat box or our Q&A. So thank you so much for answering those questions. And I would like to give you the opportunity to talk a little bit about our pharmacy services. So you kind of did that a couple of questions ago when we were asking about if you can contact your pharmacy. But can you talk a little bit about ARH's pharmacies and where we have them and what they do?
Absolutely. ARH Pharmacy is one of my favorite things to talk about. We have 14 locations throughout our service area, including Kentucky and West Virginia to serve you. Throughout our pharmacy locations, we offer a range of pharmacy services. This includes specialty pharmacy locations. We offer mail order services. We offer free delivery to local communities. We have drive-through options at several of our pharmacies. And if we do not have drive-through, then we have curbside options, which means you can call when you arrive in the parking lot. We'll bring it out to you. So you don't have to get out and come in, whether it's because of the snow, COVID, or whatever your feelings are on that matter, even convenience. ARH.org can list all of our locations, or you may be familiar with the ARH pharmacy in your local community.
Thank you. Thank you so much. So I'm very grateful to have you, Jerry Lynn, and I hope that we can make Coffee with Your Pharmacist something we do on the regular. So that would be great. I know there's not just cardiac medicines, but you guys deal with a whole lot, and there may be a ton of questions for you. So hopefully we can have you back on our webinar series soon.
That sounds great. Thank you, everyone.
Thank you. Okay, so that concludes our Coffee with Your Pharmacist webinar today. We look forward to seeing you at our next webinar, which I believe is going to be on this coming Friday. So please check our ARH Facebook pages for all of our event information for all of our upcoming webinars. And until then, please stay safe and stay warm out there. Thank you, guys.